The ongoing pandemic of coronavirus disease 2019, COVID-19, a novel infectious disease caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, spread to the United States in January 2020. Cases have occurred in all 50 U.S. states, the District of Columbia, and all inhabited U.S. territories except American Samoa. 5. All 50 states have received disaster declarations from the federal government. 6. The state of New York has seen over 15,000 deaths, more than any other state. As of April 15, 2020 update, the U.S. has the most confirmed active cases and deaths in the world. 7. The first known case of COVID-19 in the U.S. was confirmed on January 20, 2020, in a 35-year-old who had returned from Wuhan, China, 5 days earlier. 2. On January 29, the White House Coronavirus Task Force was established. 8. 2 days later, the Trump administration declared a public health emergency and announced a ban of most foreign nationals arriving from China. 9-10. On February 26, a person with no known exposure to the virus through travel or close contact with a known infected individual was confirmed by the Centers for Disease Control and Prevention, CDC. 11. The early U.S. response to the pandemic was slow, especially in regards to testing. 12-13. A manufacturing defect rendered CDC-developed test kits unusable, and regulatory rules prevented commercial laboratories from using their own tests. 14-13. Initially, President Donald Trump was optimistic, dismissing the threat posed by coronavirus and claiming the outbreak was under control. 15. By March, the Food and Drug Administration, FDA, began allowing public health agencies and private companies to develop and administer tests, and loosened requirements to allow anyone with a doctor's order to be tested. 14. By March 11, the U.S. had tested less than 10,000 people. 16. But that number exceeded 1 million, 1 per 320 inhabitants, by the end of the month. 17. Federal health inspectors surveyed hospitals in late March, reporting shortages of test supplies, personal protective equipment, PPE, and other resources due to extended patient stays while awaiting test results. 18. By April 18, the United States had processed over 3.7 million tests, around 1 per 90 U.S. inhabitants. 19-20. The CDC warned that widespread disease transmission may force large numbers of people to seek healthcare, which may overload healthcare systems and lead to otherwise preventable deaths. 21. Since March 19, 2020, the U.S. Department of State has advised U.S. citizens to avoid all international travel. 22. On March 16, the White House advised against any gatherings of more than 10 people. 23. In mid-March 2020, the Federal Emergency Management Agency, FEMA, told the United States Army Corps of Engineers to construct new medical facilities, and to convert leased buildings for use as hospitals and intensive care units. 24-25. State and local responses to the outbreak have included prohibitions and cancellation of large-scale gatherings, including cultural events, exhibitions, and sporting events, restrictions on commerce and movement, and the closure of schools and other educational institutions. 26. Disproportionate numbers of cases have been observed among African American populations, and there have been reported incidents of xenophobia and racism against Asian Americans. On December 31, 2019, China reported a cluster of pneumonia cases in its city of Wuhan. 27. On January 7, 2020, the Chinese health authorities confirmed that this cluster was caused by a novel infectious coronavirus. 27. The World Health Organization, WHO, issued its first technical briefings on January 10 and 11, warning nations about a strong possibility of human-to-human transmission and urging precautions. 28-29. On January 14, the WHO stated it found no clear evidence of human-to-human transmission, although it recommended that countries still take precautions due to the human-to-human transmission during earlier SARS and MERS outbreaks. 28-29. On January 20, both the WHO and China confirmed that human-to-human transmission had occurred. 30. A few weeks earlier, on January 6, the U.S. had offered the WHO a team of CDC health experts that could go to China to help contain the outbreak. The offer was repeated a number of times, but as of January 28, they had not received their approval. 31. Meanwhile, the CDC updated its China travel recommendations to Level 3, its highest alert. 32. At that same time, a number of U.S. organizations began sending personal protective equipment to China in late January. Boeing, the world's largest aerospace company, announced a donation of 250,000 medical masks to help address China's supply shortages. 33. While the United Church of Christ, UCC, and American Baptist Churches USA joined an ecumenical effort of American churches to also provide much-needed medical supplies to China. 34. In early February, the U.S. State Department also transported 17.8 tons of medical supplies to China, including masks, gowns, gauze, respirators, and other vital materials. 35. A few weeks later, the State Department also offered to help Iran fight its own outbreak, as their cases and deaths were dramatically increasing. 36-37. On February 7, Vice President Mike Pence said he had spoken to Chinese President Xi Jinping in a telephone call and repeated that the United States was ready to help the WHO. 38. And Secretary of Health and Human Services Alex Azar submitted names of U.S. experts to the WHO that would hopefully assist China with the outbreak response upon China's approval. He also told them that the U.S. would cover their expenses and would provide $105 million in funding, adding that he had requested another $136 million from Congress. 38-39. The first U.S. case of the new virus was also reported on January 20, in an American citizen traveling from Wuhan, China, to his home in Washington state. 27. On January 30, the WHO declared the outbreak a public health emergency of international concern, warning that all countries should be prepared for containment. 40. The WHO declared a pandemic on March 11. 26. Certain European countries, including Italy, Spain, and the United Kingdom, reported coronavirus cases in late January. 41. 42. 43. More than 3.4 million people from China, Italy, Spain, and the United Kingdom, including returning Americans, entered the U.S. in the first 3 months since the coronavirus outbreak in Wuhan. From December 2019 to February 2020, 759,493 passengers arrived on American soil from China, 343,402 came from Italy, 418,848 from Spain, and about 1.9 million more arrived from Britain. 44. Research on coronavirus genomes indicates the majority of COVID-19 cases in New York came from European travelers, rather than directly from China or any other Asian country. 45. In March 2020, the European Commission's President Ursula von der Leyen and other EU leaders condemned the U.S. decision to restrict travel from the coronavirus-affected European Union to the United States. 46-47. In a series of travel restrictions announced between late January and mid-March, the United States government denied entry to foreign nationals who had traveled within the past 14 days through China, Iran, the United Kingdom, Ireland, or the 26 European countries that comprise the Schengen area. Americans returning home after traveling in these regions were required to undergo a health screening and submit to a 14-day quarantine. 48-49. Such quarantines are governed by Section 361 of the Public Health Service Act, 42 U.S. Code Section 264. 50-51. In early March, the CDC advised Americans against non-essential travel to China, Iran, Malaysia, and the aforementioned European countries. 52.